Hello guys, I have a question for you. What is berberine? Do you know that berberine is one of the most effective natural supplements for human health? It is one of the few supplements shown to be effective as a pharmaceutical drug. Berberine is a yellow colored and bitter tasting chemical that can be extracted from different plants. It might help reinforce the heartbeat, which could benefit people with certain heart conditions. It controls how body uses sugar in the blood and helps reduce swelling. Here are some major effects of berberine on human health. One of the most important effects of berberine is a big reduction in blood glucose. The result of several clinical studies shows that berberine causes significant decrease in hemoglobin A1C, fasting blood glucose, after meal blood glucose, and plasma triglycerides. Berberine performs its action on glucose through the inhibition of alpha glucosidase, which is an enzyme to break down the starch into simple sugar. Co-administration of berberine with some other medications in diabetes result in better glycemic control. Another important effect of berberine is weight loss. Recent studies have proven that berberine presents pharmacological activities and positive effect on the risk factor of obesity and metabolic syndrome. In a clinical study, berberine administration of 500 mg 3 times per day for 12 weeks lowered weight by 5 pounds on average. In a preclinical study on mice, treatment with berberine suppressed appetite and lowered body weight. Effect on cholesterol. Taking berberine by mouse alone or with other ingredients might help lower total cholesterol, low density lipoprotein or bad cholesterol, and triglyceride levels in people with high cholesterol. Berberine is found to be effective in gene regulation for the absorption of cholesterol at a daily dose of 300 mg in humans. Effect on blood pressure. Co-administration of 1 gram of berberine by mouse daily along with the blood pressure drug amlodipine reduce blood pressure better than taking amlodipine alone in people with high blood pressure. Cardiovascular effect. In many clinical studies, berberine administration is helpful for cardiovascular disease. The result of a recent clinical study on 140 coronary syndrome patients shows that administration of 1 gram of berberine for 4 weeks lowered triglyceride and LDL or bad cholesterol and markers of inflammation such as CRP and IL-6, and suggests that berberine is effective in global management of cardiovascular disease. Infection. In several clinical and preclinical studies, it has shown that berberine is effective to fight harmful microorganisms, including bacteria, virus, fungi, and parasites. Dosage. In many clinical studies, administration of 500 mg 3 times per day is effective for many health benefits of berberine, which I mentioned before. Side effects. Berberine has exceptional safety report in clinical studies as no serious side effects from berberine were reported. The main side effects are related to digestion, and there are some reports of cramping, diarrhea, flatulence, constipation, and stomach pain. Okay guys, we enter the end of discussion. If you have any question, leave a comment below. You can support my channel by liking and subscribing so you could be able to watch my future videos. Thank you for watching and being careful about your health.